The broadcast is now starting. All attendees are in listen-only mode.
Assalamu alaikum and good day to all. Respected Professor Asim Ali Khan sir, Director General CCRUM and Advisor Unani Ministry of Ayush. Professor M.A. Jafri sir, Department of Ilmul Adwiya, School of Unani Medical Education and Research, Jamia Hamdard. Respected Dr. Dinesh Kataria, Professor and Head Department of Secretary, Lady Harding Medical College, New Delhi. Respected Professor Muhammad Idris, Head Department of Unani Medicine, Ayurvedic and Unani Tibbiya College, New Delhi. All participating registered delegates. I welcome you all to day 4 of the webinar series organized by CCRUM, Ministry of Ayush. Friends, as we are aware that Ministry of Ayush, along with its research councils and national institutes, has taken many steps in combating the difficult time of COVID-19 pandemic. This webinar series organized by CCRUM is as per the mandate of Ministry of Ayush, its IEC activities, to create awareness and provide scientific platforms for deliberation on various aspects of COVID-19 pandemic. And in the past 3 webinars held during this webinar series, we had fruitful deliberations on the lessons learned, role of nutrition in maintaining health and management of COVID-19 cases, experience sharing from eminent speakers. We got a good feedback and suggestions from our participants, and we thank our learned speakers from Vardhaman Mahavir Medical College and Safdarjung Hospital, New Delhi, Department of Ayush, Government of NCT of Delhi, Department of Food Technology, Delhi University, AK Tibbiya College, Aligarh Muslim University, and Kashmir Tibbiya College Hospital and Research Center for giving their insightful talk. So here we are on day 4 of the webinar series, where we will be discussing taking care of mental health during and after COVID-19, which is an important topic. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from our childhood and adolescence through adulthood. So to inaugurate today's webinar, we have our Director General Sir, Professor Asim Ali Khan Sir, with us. Before inviting him, to those new participants who have joined us today, I will inform that Sir is the Director General of CCRUM, Ministry of Ayush, a leading institution of scientific research in various fundamental and applied aspects of Unani medicine in the country. He is also holding the charge as Advisor Unani in Ministry of Ayush, and he is the member of Board of Governors, National Commission of Indian Medicine, Government of India. Sir is directing and coordinating various research and academic activities of CCRU and collaborative research programs with leading academic as well as scientific institutions of the national and international importance through its 22 peripheral institutes spread across India. He is a member on various important committees of Government of India. I take this opportunity to say that Sir has taken many new initiatives for propagation and promotion of Unani medicine, and bringing more robust standard in Unani healthcare services is his vision. With this, I invite Sir for his inaugural address.
Thank you, Dr. Ghazala. Thank you very much for this introduction. Professor M.A. Jafri Sahib, he's the head department of Ilmul Adwiya, the Unani Pharmacology, School of Unani Medical Education Research, Jamia Hamdard, and he was the former director of National Institute of Unani Medicine in Bangalore, one of the Government of India's premier institution, and also the former Chancellor, sitting Vice Chancellor of Jamia Hamdard University. Professor Muhammad Idris Sahib, our colleague, he is the Department of Unani Medicine, ANU Tibbiya College, New Delhi, and he was also the former principal of that college. Professor Dinesh Kataria Sahib, Professor in Head Department of Psychiatry, Lady Harding Medical College, New Delhi. All participating registered delegates, ladies and gentlemen. Assalamu alaikum and a very good afternoon to all of you. I welcome you all to this fourth webinar in the series of COVID-19 pandemic, Experiences and Lessons Learned, that is being organized by CCRUM, Ministry of Ayush, from 15 to 21st December 2021. As I said, this is the fourth webinar. Last week, we have had very informative lectures on lessons learned during COVID-19 pandemic, the role of nutrition in maintaining health, and management of COVID-19 cases, the experience sharing. Our esteemed speakers from Vardhman Mahavir Medical College and Safdarjung Hospital, New Delhi, Department of Ayush, Government of NCT of Delhi, Department of Food Technology, Delhi University, AK Tibia College, Aligarh Muslim University, Kashmir Tibia College Hospital and Research Center, Jammu and Kashmir. They all had enlightened us and our audience by sharing their experiences during the management of COVID-19. And we have gained insights on how important it was to join all available resources to contain the spread of the pandemic. Based on their experiences, the experts had also suggested strategies and measures to be adopted in case of any such challenge or challenges in future. The contributions to the Ayush systems in maintaining health and improving immunity were also outlined by the speakers in these webinars. The theme for today's webinar is a very important topic, taking care of mental health during and after COVID-19. Friends, we all would agree that the pandemic of COVID-19 was on a completely different scale than any other pandemic witnessed by us to date. It had shaken the entire world and created a global panic. The uncertainty associated with this pandemic had created fear, worry, and stress. There was fear of contracting the virus. There was overwhelming worry and anxiety about its impact. And in addition to all these, the necessary social distancing had made it even more challenging. It had changed the way we were living our life. People's daily routines were altered. There were financial pressures, unemployment, and social isolation. People were experiencing stress, anxiety, fear, sadness, and loneliness. There was also a relentless spread of a mix of accurate as well as inaccurate information on social media that had a psychological impact on the community. In this situation, mental health disorders, including anxiety and depression, had worsened. The presentations also included biological effects like sleep and appetite disturbances, as well as severe mental illnesses and subject misuse. And for most of these symptoms, they were mild and transitory, but some had developed several and severe mental health issues that required additional mental health support. Therefore, it became very important to take care of both physical as well as mental health during this COVID-19 pandemic. We all know that Unani medicine recognizes the influence of surroundings and ecological conditions on the state of health of human beings, which includes both physical and mental health. For maintenance of health, Unani medicine especially places emphasis on the 6 essential factors. We call this Asbab-e Sitta Zaruriya, that is air, food and drink, bodily movement and repose, psychic movement and repose, sleep and wakefulness, and evacuation retention. It is worth appreciating that mental health is included as one of the 6 essential prerequisites for maintenance of health. The mental health issues emerging during the pandemic can be successfully, economically, and safely prevented by following the instructions with regard to these essential factors. In Unani medicine, psychiatric disorders are dealt in detail under the heading of Amraz-e-Nafsaniya. The classics of the Unani system of medicine clearly lay down that maintenance of health, that we call as Hifzan-e-Sehat, is superior to treatment. The Unani system of medicine treats psychiatric diseases and psychic elements of psychosomatic diseases by using lifestyle modifications, drugs, modifying mind-related processes like sleep and psychotherapy, etc. The medical professionals as well as the caregivers need to recognize and address the mental health issues emerging during this pandemic. Help and support is vital for persons with mental illness, from their families and other caregivers as well. We need to provide adequate training to healthcare professionals so that they are able to provide appropriate care. Ensuring a good mental status in the difficult times will help us win the battle against this pandemic more easily. Our esteemed speakers for today, I'm very sure and confident they will be sharing their knowledge and experience on taking care of mental health during and after the COVID-19. I welcome our esteemed speakers, Professor Muhammad Idris, the Head Department of Unani Medicine from AKTB College, New Delhi, and Professor Dinesh Kataria, who is the Professor and Head Department of Psychiatry, Lady Hardinge Medical College, New Delhi. I again welcome Professor Jaffrey, who is the former Vice Chancellor of Jamia Hamdard and former Director of National Institution and presently the Head Department of Muladvia, the Unani Pharmacology, the School of Unani Medical Education and Research, Jamia Hamdard, who will be moderating this session. Not taking much time and giving more space to our learned speakers and the audience to have one-to-one questions or through chat box. I leave this platform. I'm confident that the presentations by the esteemed speakers today will be of immense benefit to all our participants and our colleagues who are participating in this webinar. Thank you very much and Jai Hind.
Thank you, sir. Thanks a lot for enlightening us on the importance of mental health and giving us that insight into Unani perspective. Now we begin with our webinar on taking care of mental health during and after COVID-19. First of all, I will invite the moderator of the session, respected Professor M.A. Jaffrey, sir. Sir has done his BSc from Meerut University and BIMS from Hamdard Tibbi College. Besides having an MD in Ilmul Adviya from AMU Aligarh, besides having experience of 35 years of teaching and research in Unani medicine, he has about 23 years administrative experience working as head of the Department of Ilmul Adviya, including 3 terms as Dean of the Faculty of Unani Medicine, Jamia Hamdard. He served as director in National Institute of Unani Medicine, Bangalore, an autonomous organization under Government of India for more than 7 years. He had also served as Vice Chancellor Jamia Hamdard for more than 7 months. Presently, he is professor in Department of Ilmul Adviya, School of Unani Medicine, Education and Research, Jamia Hamdard, New Delhi. The list is long. He has received many accolades, and we are thankful to Professor Jaffrey sir for joining us. Before handing him over the session, I would also like to introduce our first speaker, Dr. Dinesh Kataria, Director, Professor and Head Department of Psychiatry and Drug De-Addiction Center. Sir is currently working as I just mentioned his designation, Director, Professor and Head of Psychiatry, Lady Hardinge Medical College. He completed his MBBS from the prestigious PGIMS Rohtak. He did his post-graduation MD Psychiatry from the same institute, where he also completed senior residency. Later, he joined as a faculty at Lady Hardinge Medical College. He has the unique distinction of having 13 degrees, diplomas to his name in various fields. He has multiple research publication and book chapters to his name. He is a dynamic teacher and is known for his skill in simplifying the various concepts of psychiatry to his students using relevant examples. He is known to be a fine orator who can speak on any topic. He has special interest in the fields of general adult psychiatry. In addition to his teaching and research experience, he has vast administrative experience as well. Thank you, sir, for joining us and sparing time for us. I request you for your presentation, please.
Thank you, Dr. Ghazala, for this celebrated introduction. So, first of all, at the outset, I'm really thankful to CCRMU team that they have given me a chance to speak on the topic taking care of mental health during and after COVID-19. I'm thankful to Professor Asim Ali Khan, Professor Muhammad Idris and Professor Jaffrey And I will try that I will finish well within time. I will try, and I hope that instead of making a little more of academic in nature, we will be presenting our own things in between wherever required. So with this, I start my presentation. I hope I'm audible.
Yes, sir. Clear, loud and clear.
Okay. So earlier, as the slide is visible, earlier we were not like this. You know, everybody is with mask. Every man, most of them are with the caps, right? And PP are worn, right? So we didn't see that type of this thing except in the operation theaters otherwise. But now this has become a common scenario in the hospital setup and outside also. Just to beginning for that. And so I will be covering my talk under following headings. So I will be talking about little bit introduction, then mental health issues related faced during pandemic, intervention and management, experiences of our team, and then conclusion and lessons for future ahead. So possibly these will be the headings, but the boundaries will be little bit blurred in between. Uh, So COVID-19 pandemic has significantly increased the rate of mortality and morbidity worldwide. We know it. There is no doubt about that. And common mental health problems faced were, as Sir have already told during the introduction and the beginning speech, the anxiety were there, depression, adjustment disorders, phobias, insomnia, and other sleep disturbances were there. And suicide risk also increased. The challenging issues that increased, what they were: symptoms of PTSD, some of them have not witnessed in their lifetime, burnout, depression, and anxiety, it also increased. And some new phenomena also emerged in this COVID era. It was a subsyndromal anxiety issues, means it was not exactly anxiety, but little bit say near about anxiety. So, so this was when the worried well. Worried well means even if you are well, people were worried whether they may have or they may not have. Or so whenever there was some sort of sneezing, so everybody was thinking that now I've got COVID. Someone was having cold, they were worried about COVID. And say if you came in contact or you touched something, then there was a fear or this thing that they may have. So this was a worried well phenomena. Then there was one infodemic. Infodemic means there was a pandemic or epidemic of the information, because you know every day the things were changing, and this WhatsApp university and so many other social media and other things, right? Some was were relevant, some was very irrelevant, someone was factual, and the number was so much that one was flooded with the information, right or wrong. So this term, it came as a infodemic. And the same thing is the coronaphobia. There is excessive and this irrelevant fear of this thing, corona. So the coronaphobia was also there. So these were the few new terms added during that era, or now also. So this slide, although it nutshell, it describes most of the things. So what happened? What were the, in short term, what were the COVID-19 direct effect and the COVID-19 indirect effect? So let me tell about the short term earlier. So what was the event? Event was threat from the COVID-19, perceived and actual. So both type of these things there. And the impact was that that threat lead on to the what? Anxiety, exacerbation of the existing this mental health problems, bereavement things were there, and it led on to the depression. Similarly, indirect effects were the lockdown and isolations were there. This lockdown and isolation, they produced anxiety, depression, exacerbation of the existing psychotic symptoms or psychiatric symptoms, and increase in alcohol misuse and other addictions. It definitely increased, and educational impact were there because schools and colleges, they were closed. to that extent that some of the university, they promoted the students without taking exam, at least of the middle or the in-between exam, not the final one. And there was fear of potential economic impact also. Again, it led on to the anxiety, increased anxiety. Adversely affected personal relationship were there, and domestic violence, it also increased because they were living in the home for a long time, which they were not habitual of. It led on to the anxiety, depression, and PTSD. And then medium to long term effects were there. Event was that post this ICU syndrome, so in which again anxiety, depression, PTSD, bereavement, prolonged grief, complicated grief, psychological impact on front line of the staff, and the PTSD were there. Economic impact was there. Unemployment was there. Job insecurity was there. Income reduction was also there. I remember that one of the faculty in one of the college, earlier he was working for the 60,000. Then the management asked, if you want to work for 20,000, you are most welcome. Otherwise, you may leave. And that my faculty friend left. Increased debts because people, they didn't have the money and they had to borrow. So there, the housing loss means the some of the landlords or otherwise, they got their rooms vacated or the household got vacated, and the loss of socio-economic status were there, and stigma was also there, and that again led into the anxiety, depression, and the suicidal ideations or intent, and the suicide also increased in alcohol misuse and other addictions. Similarly, adversely affected personal relationship were there, right? So many fights and domestic violence. So it has an impact again, anxiety, depression, alcohol use and misuse, and PTSD were there. Although this slide, it looks crowded one, but most of the things are embedded in that. So when I will be talking about impact, so we will be talking about general population, healthcare worker, and COVID-19 patients. So these are the things we will be discussing. So in general population, what happened? Although Dr. Ghazala told in between, but if I talk about mental health, as per the WHO, the mental health has got said this thing. It is a state of mental well-being in which ability to understand the potential of the self. One thing. Let us talk about exactly what exactly mental health is there. What Dr. Ghazala told, it is absolutely true that feeling, thinking, knowing, and all these things are there. But the definition is that one is have a potential ability to understand the potential of the self. One knows that how much potential or ability one has. You know, say at least when I have got around 70 kg of weight, and I should not fight with with Khali. So I know that I do not have that much of this thing, and I should not take any fight with Khali. He will throw me out. So I know my potential, and possibly I'm not going to fight with Khali. Then one can adjust to the daily ups and down of the life. You know, daily, say someone is coming from a far distance, someone, sometimes the red lights are there, sometimes jam can be there, crowd can be there, possibly threats can be there. So these are the ups and downs of the life. So these are, one should be able to adjust with that. Then one should be able to work, not only work, it should be a fruitful work. So this is the third one. So someone is, if it is not working at all, it means he's not mentally healthy. And fourth one is that there should be community participation. So I repeat that one should be able to understand the potential of the self. One should be able to adjust to the daily ups and downs of the life. One should work efficiently and fruitfully. And fourth one is the community participation. So these are the four things that a mentally healthy person should have. Even if someone is having psychiatric illness or some mental health problem, even then one can be mentally healthy. So if the things are settled and one is doing all these things very well, it means he's mentally healthy. Even the mentally or the psychiatric disorders persons who are well settled and the maintaining well, they can also be mentally healthy. It doesn't mean that they are not mentally healthy. So what happened during the quarantine? Uh, so during the quarantine, when people were say sort of in a limited area, or they were not able to go out, so there were confusion that what will happen. So they were angry, and there were acute stress related symptoms were there. So what actually were during the quarantine? So that is effective and rapid communication. So clear and crisp communication was the key, right? Because there were so many doubts what will happen, what type of fever, and how many days, or for how long we will be there. So effective and rapid communication with healthcare team and with family on phone. So this was the key of the communications, because over the phone things were most easily discussed. And the another thing was that this was the mental things were there, and the physical supplies, that eatables, medicines, right? So these were the supplies were required. So these were the things required at that time. What were the again, see, same thing. So those who were contacted through telephone, duration was kept minimum, and it was clearly communicated in advance also. But people were also confused, because during that time there was frequent changing of the guidelines, and there was an emphasis of the altruistic choice of self isolation and appreciating. Those who were sent in quarantine forcibly, they had more problems than those who chosen it themselves. So these things were a bit relieving for them, except those who were given forcible sort of advice, or they were kept in quarantine for forcibly. Most of the adverse effects came from the imposition of the restrictions of the liberty, because they were not able to go outside. There were sort of curfew-like situations. And the same thing which I've already told, voluntary quarantine was associated with less distress and fewer long-term complications. So there were effects on the sleep, and I'm trying to show the relevant these clinical journals in which these were published. So the sleep problems were 18% in the general populations, and 57% was there in COVID-19 patients. Sleep problems were associated with depression and anxiety. So when people were not then, so they were basically affecting each other. Sleep problems were leading on to the psychological distress, and psychological distress was leading on to the sleep problems. Then there was a behavioral impact of the COVID uh, in general population. 34% was reported anxiety, around 42% reported depression. So depression and the irritability was the most common one. The same is the percentage. 30 around 31% was inattention. Around 22% were significant fear of COVID-19. 35% was boredom, and around 20 earlier, as I earlier mentioned, was the sleep disturbance. So what happened in the adolescents? Higher rates of anxiety, depression, and stress were there in adolescents, and higher frequency of using alcohol and cannabis it also increased during the COVID time. What happened to the young children? In young people, anxiety and loneliness was there, and among children, stress, sadness, frustration, and indiscipline and hyperactivity were there. And it was very difficult for the parents to having a control over hyperactivity, because there was a limited space, right? And they were not able to go outside for other activities and all that. What actually worked for adolescent and children? So social support and the advice from the others, positive coping skills, behavior activation strategies, parent-child discussions were there. What happened on the marital relationship? So there were lot, they were staying together for long times, and they were not able to go outside. Some were the effect of the employment also. difficulty of the supplies were also there. So there were a lot of marital conflict, reduced intimacy was there, and the domestic violence increased, and the percent of that domestic violence increased during the COVID time. So in one of the Journal of Criminal Justice, again it published in 2021. So there was an overall increase with an overall mean effect size of the 0.66. Impact on perinatal mental health, because we also witnessed this Lady Harding Medical College have got its very two big things. OBS and gynae department and this and the pediatrics, these are the main things which are very big in size. So 40% this perinatal antenatal anxiety symptoms were there. Antenatal depressive symptoms were 27, and I'm covering almost all the populations. And 17% postnatal depressive symptoms were there. Impact of social isolation on elderly. Now we are talking about elderly people. It was published in the Journal of Public Health. And loneliness caused by the social isolation was found to be associated with impaired cognitive functions in the older adults, because they were not aware of the dates, and they were not aware of the time and what was happening outside, and so they faced difficulty. So there were few new phenomena also there, which I already told. Coronaphobia was there, an excessive triggered response of fear of contracting the virus causing COVID-19, leading to excessive concern over physiological symptoms, significant stress about personal and occupational loss, safety-seeking behavior, avoidance of public places. People were afraid of. There were people who did not go out of the home continuously for 4 to 6 months, and situations causing marked impairment in the daily life functioning. Triggers involve situations or people involving probability of virus contractions, such as meeting people, leaving house, traveling, reading the updates or news, falling ill, or going for work outside. So what exactly was there? Cognitively, there was stress about personal and occupational loss, leading to emotional fear, sadness, and guilt. Behaviorally, there was increased reassurance, safety-seeking behaviors, and avoidance of public places and situations. And then physiologically, there was excessive concern over the physiological symptoms, and this all led on to the coronaphobia. And again, unforeseen reality, external risk factors were there. Unforeseen reality, unending uncertainties, loss of faith in health infrastructure, and statements from the international bodies, and there's a lot of flooding of the information. And there's a psychological process where that interference with the routine life was there. This catastrophic interpretation was there. Social amplification of the risk were there. So there was a fatigue-like situation. There was behavioral fatigue associated with other adherence to the COVID restrictions. So people got tired. Even the physicians and the mental health professionals or other professionals, they also felt tired because of this thing. They were tired of wearing mask, tired of wearing PPE, right? It was such a long time. Probably they did not witness during their lifetime. Then the worried well phenomena I try to tell in the beginning. Frequently in hospitaling to know if they have the illness or not. People were visiting frequently to the hospital, even if they had a little bit of sneezing or little bit of this thing, or there was some sort of other illness. So everything was being taken as a COVID. So it was a overburden for the healthcare system. There were lot of patients, we were not able to deal with that. So there was an increased cost to the health. The manpower was also less. Diagnostic kits in the beginning, it was a problem. So there was a shortage of gloves, PPE, etc. We have all seen that. Buying of drugs that were being circulated as possible prophylaxis. So people hoarded or they this had a number of medicines they kept in advance, that whenever they will have some problem, so that will be used. So hoarding was there, right? And unintentionally absorb a great deal of attention in their pursuit of reassurance, because a lot of don't worry and all that, So there were so many reassurances also, even if they were not required. Then how it was managed? So with the impartation of the right information through use of various prints and broadcasting media about symptoms and about who should visit the hospital and who should not. And we remember that there were lot of information was sent that everybody should not visit to the hospital because the hospitals were overcrowded and at that time, and over flooded almost, and reassurance and education was the only key, IEC, through IEC, etc. Now let me talk about reflections about mental health coping and service utilization during pandemic. What happened? Pre-COVID period, what we were doing? We were using mature coping. Those who were using mature coping strategies during stress, good adaptive mechanisms were there. They managed well, but they had some difficulty in coping with the extreme situations. Their copings were good with the small sort of problems, but when the COVID unexpectedly came, so they also had a difficulty or in adapting to the extreme situations, because the number of hours were more in the hospitals, number of patients increased, number of deaths were increased. So even those who had a mature coping strategies, they also felt difficult in extreme situations. Similarly, in pre-COVID period, those who has immature coping strategies during stress, they faced difficulty to adapt extreme situation in normal things also. So they, because of their poor what happened during the post COVID period, they had poor COVID strategies during stress, and they were not able to adapt to the extreme situations, and they required guidance and counseling for those who are immature coping. Those who are having mild or minor mental illness, I'm talking about mental health problems. So those who are not requiring professional help at that time, what happened? Most of them, they required guidance and counseling, and the medicine requirement increased for those type of people. Those who had major mental illness in the past and received professional help, so they had number of relapse. The relapses or chances of having relapse were more. They required more guidance and counseling, and the dose of the medications were increased in those. And those who are having major mental illnesses, they were well maintained on the treatment, so their problems, they increased, and they had mental illness attacks which were severe one, and they required more guidance and they required admissions and the other support, counseling and medications. So this sort of graph is predicting the same. So pre-COVID, when there were less number of requirement, so the COVID, it suppressed the requirement, but post-COVID, there was almost sort of mental health problem increased, and there was lot of crowd in the hospitals. Now I will be talking about this healthcare worker. So earlier, so there was we were talking about always the army at the borders and in the difficult areas. So this again, the army was in white and green, means the healthcare professionals were basically army for this sort of pandemic. What happened in the healthcare workers? So in healthcare workers, 43% they faced depression, 30% anxiety, 44% they had sleep disorders, and acute stress was there more than 55% or 56%, and post-traumatic disorder or stress was in 20%. So what were the contributing factors? High work pressures and workload, because I remember that most of our psychiatry resident, they were posted in COVID duties. Almost more than 70% they got corona infection, but thankfully, because of the vaccination or this COVID sort of precautions they took, so some of them, they were not available for work, but somehow they worked very well. So there was high work pressure because there were less number of people available, and there was an uncertainty about poorly known and deadly disease in the beginning period. And there are, because we were not prepared for that, so there were sort of, we were not in habit of using PPE for long number of hours, and the electricity and the connections and all that, those things were there, with difficult period, shorter time for social interactions with the patients, and we used plastic sheets. We were not interacting directly. There were a lot number of deaths, and the family visits were less. Even if we were visiting the family, so that it was not the previous one. Earlier, we were frequently taking bath and all right, changing clothes and precautions, and we were not meeting the elderly and our children and all, so on and so forth. Similarly, post-traumatic stress symptoms were there, and the risk factors were low social support at work. There was, as I already said, heavy workload was there. Working was unsafe in unsafe setting because there was lack of PPE and other things were there also there. So coping strategies were not proper. Anxiety and burnout issues were there, and the pre-trauma risk factors were the, even women were at more risk, young age was the more risk, and low work experience was there. We were not, say, even a psychiatry resident or the physiology postgraduate resident was working in the corona ICU and all that at these places, because every time this anesthesia doctors and the emergency doctors of the medicine people were not available, right? So many people fell sick because of the COVID also, and there were lack of training in the beginning also. So there was burnout. So it is a syndrome conceptualized as a resulting from chronic workplace stress and has not been successfully managed. So three dimensions were there: feeling of energy depletions or exhaustion, increased mental distance from one's job, or feeling of negativism or cynicism related to one job, and reduced professional efficacy. They were tired basically of all these things, wearing masks, and for long duty hours, they were not able to meet family physically and all that, right? So what interventions we took? Some strategies to improve mental well-being during pandemic means that one should keep oneself informed. So during that time also, the guidelines were frequently changing, but with the proper guidelines, we were able to deal with that with guidelines and recommendations from the reliable sources. Not from, there were so many things which were being run on the WhatsApp University or other social media platform, which confused us. But somehow the real guidelines were also there when we followed, so things were safe. So we were, so the one will had to maintain a routine with the daily routine as far as the possible, or make new ones. So if one gets up at a similar time every day, or go to the sleep at then, and personal hygiene again was very important. Healthy meals were very important. Regular exercise very important, and the allocation of the time for working and time for resting also there. People were working from home, and it was a very difficult. Initially, they enjoyed. Okay, they are not going outside, but then it was a burden, and the making time or doing things, at least indoor sort of things were there, which were giving you help. Some strategy for improving the mental well-being. What strategy they help? So one thing was that although social distancing, man is a social animal, but I don't know how for this social distancing this term came in. WHO also did not favor that. So basically, if we would have said that the physical distancing, it would have been a better. But later on, people started saying physical distancing, and it was a welcome step. For the alcohol and the drug use should have been avoided, or it is to be avoided, so it can improve the mental well-being. So screen time should not be, one should not be able to, one should not spend much time on the screen for the mental health. Otherwise also, not during the epidemic or pandemic. So screen time should be limited one. Make sure that you take regular breaks from the on-screen activities. Video games, it should be for this small time, not for a long time. While video games, one can be way to relax, it can tempting to spend much more time on them, and usual when at home for long periods. Be sure to keep the right balance with offline activities in our daily routine. And even similarly, the social media use. So many things were there on the social media and so many dreadful stories and all that which frightened us. Then help colleague in need. So, the most important thing was that our own friend circle, those who had got connection or the good social connect, so they help, the most of the help came from there. And those who had got a good friend circle or social circle, although there was social distancing was said, but people were well connected during that time, and we could face the pandemic of this thing, and we could make ourselves mentally healthy. So the colleagues, so this helped us a lot, and there was no need for discrimination, although it happened in between. But somehow those who were not unreached, but was reached by the, if you see, so many things were there when healthcare worker reached to the unreached, and the grief and bereavement were handled very beautifully in some of the areas. So this was a circle of control. Again, so many things they were not under our control, like the news and the natural disasters. These were not, environment was not our under control. The economy also went down, right? So these are the things which were not our control. So what we could control, we could control our own habits, we could control our own area, we could control whatever we wanted to read, or the with whom we wanted to spend some time, at least on the social media. And we, there were so many things, so many people who were writing, started writing or cooking foods and all that, right? And there were some in between also. Say, then there were few compromises that we were not able to go outside for walk, but these small place exercises we did, right? So many things were there. So, what were the strategies to improve mental well-being of the people and the healthcare workers? Psychological first aid was there. Workplace environment could be improved, or at least people were working from the home, but healthcare workers were definitely coming to the hospital. Mindfulness-based programs, so many agencies worked for that. Mental health support group were there. Psychological safety at workplace were discussed. Regular workshops and updates were there. Rather, I have never seen, so there was a flooding of the information through webinars, webinars and this type of information, right? And this is the same, but we are talking now. So, what was there in the psychological first aid? Respect safety and dignity of the rights of the others. Also, adapt what you do to take account of person's culture. We should respect others' culture. Be aware of the other emergency response measures. Look after yourself. Good communication skill for the psychological first aid. Prepare or learn about the situations. Action principle of the psychological first aid is the look, listen, and link. So first you look what is happening, then listen to the people, and then refer them or send them to the right person for the help. And then you should say sort of minimize your help later on. Getting ready to help, managing stress, and the reflections were there. So look, listen, and link were there for the psychological first aid. So what were the do's and don'ts? So we let us talk about the do's. So trustworthy were there, respect people's right to make their own decisions, be aware and set aside your own biases and prejudices. We saw so many things on the social platform talking about other religion and this thing, right? And they were not talking about the other things. So many things were there. Everybody knew it, and I hope you are getting what I'm saying. So we should respect privacy, and so many breach of the privacy were there. So though so many posters were pasted on the outside of the home at that time, right? And there was stigma, and that confidentiality was lost. And so appropriate behavior one should have as per the culture, age, and gender. So what happened to the patients? So Delirium was there when there were confusion was there. They were not aware of the time, place, and person. They were passing urine and stool in clothes. Dementia was there. It deteriorated. Brain fog was reported during the COVID time. Depressive symptoms were there. Anxiety symptoms were there. OCD symptoms were there. Suicide it increased. Psychosis it increased, and the post-traumatic stress disorders they increased. And similarly, drug-induced psychosis, when we talked about chloroquine, hydrochloroquine, and corticosteroid, with that also, the mental health problems, they emerged a lot because people were taking precautionary measures, and when things were not actually happening, people were taking these measures, and they had mental health problems. And the suicide risk also increased during that time. So what happened? That behavioral and pharmacological therapies were in use at that time. So and the hospitals were overburdened, right? And the you all know that medicine supplies were hoarding was there. The rate increased for the medicines. Black marketing was there, right? And the even oxygen and all that. I think still we have not forgotten those days. What happened from our side? Psychiatry, to tell you that our psychiatry department in whole Delhi, we never stopped. We never closed our OPD. We were there just like normal OPD, we were running our OPDs. Rather, we increased our medicine supply from 1 month to 2 to 3 months so that people will not have to visit. And we did not stop our OPD. Our IPD, inpatient services were continued, emergency services were continued, electroconvulsive therapies were continued. We started telemedicine services during daily and during every single day we continued. And telemedicine for the patients, telemedicine for the healthcare workers, telemedicine for mental health promotion, and we created a mental health support groups because so many non-pharmacological help were not with ourselves. So we put on a website and we made a group of other friends, those who were from the psychology or other mental health related background, and we made a mental health support group, and it was a wonderful group. It helped a lot to the people. So these are the few photographs. This telemedicine was started, the then director, Professor N.N. Mathur. It was started on 25th of the March, right? We 6 days a week it all ran, and it was extended to the round the clock provision to call on our mobile numbers of few psychiatry residents and faculty members. Again, we started it on the May 2020. So these were things available on our website also. So these were the few photographs when they were doing in their rooms, from their rooms. And the telepsychiatric services were for mental health promotion, stress management sessions, diagnosis and treatment, peer group support sessions, and we had a Microsoft Team platform. And for diagnosis and treatment for individual, we used WhatsApp, Vaidya Vahini, and eSanjeevani. The beneficiaries were patients, healthcare workers, and family members. Similarly, peer group support sessions were there, in which WhatsApp audio and video calls were done. The beneficiaries were healthcare worker and family members. These were the principles which we followed. Team of psychiatrists attended calls and offered pharmacotherapy and brief psychological support services based on clinical need. On-site assistant was also available, and special useful for anybody in quarantine or in isolation due to COVID exposure or infection where in-person contact with mental health services was not possible. Service users were ensured about maintenance of confidentiality during service, and we asked them if they needed the medicine also. So we were giving medicine for 2-3 months at a time. They were able to collect medicines prescribed from telemedicine prescription from hospital pharmacy. So really they were taking print of that, and our prescriptions were honored by the CGHS pharmacy directly. Issues addressed in group sessions were this stress management, mental health promotion activities to encourage the identification and seeking help, increasing ventilation of emotions, and addressing common cognitive distortions and fear. And what actually we conveyed through healthcare work group sessions, we took stock of situations in the things which were out of control, spending some time each day recounting a few things they accomplished, staying informed, avoid information overload, and we stay connected. Message conveyed to healthcare group sessions were the help them to acknowledge burnout syndrome because our own healthcare colleagues were also having some problems. They were asking to take regular break to related to the released stress or distress. So there was exchange support with the trusted colleagues at work having similar experiences may help in validation of each other's emotions. And mental health group, as I have already told you, that it helped us a lot, and we worked from 9 to 9. Even my number was there for the Indian Psychiatric Society, North Zone Psychiatric Society, Delhi Psychiatric Society, and even from of the mental health support group. So there were frequent call at even odd hours, and we never said no. So, and there was one more thing which I would have otherwise forgotten. During those times, during the COVID times, for healthcare workers and otherwise, see the all roads were sort of without crowd and all that, and over so many residents and senior residents and faculties also, because the roads were not crowded at all, and it was a sort of that curfew-like situation, but healthcare workers were attending their duties. So some of our residents, they had fines of overspeeding more than 1.5 lakh or so, right? But later on they were means sort of adjusted later on. But those were the days also when financial losses were also there, right? So this say proper eating with social contacts, with this sort of having good relationship with the family and friend, and physical exercise, eating properly, right, when not taking alcohol and smoking, etc., and with right kind of sort of information sharing, we could have or we can have good mental health among healthcare workers also, among the general population also, and among patients, those who are affected also. With this, I conclude that adversity and unpredictable nature of virus increased mental health problem, but we don't have all the facts. We cannot remove all the risk, cannot promise zero loss, because it is practically not possible, and we cannot eliminate all the pain. Even then, the mental health promotion is very important for individual, means that seeking social, family, and psychological support. For institutes, the training workforce in psychological first aid, and form mental health support groups, and seeking help for other affected. We did not, or we do not hesitate to seek professional mental health services, linking early to mental health services for past mental disorders and history. Right. So thank you. With this, I finish. Thank you very much.
Thank you, sir, for giving us such a comprehensive talk. Yes, indeed, we were, facing a lot of challenge, and you spoke about worried well, infodemic, coronaphobia, and there was, knowledge spreading through WhatsApp University and everything, which was not, coming from scientific sources. And very important thing you highlighted, that knowing one's potential on coping pressures of daily ups and downs of life, and mental health challenges were at every level, whether when we were staying at home or in quarantine condition, isolation, and various restrictions, and yes, there were sleep problems also. So in total, it was a difficult situation which was challenging at all levels of the society. And to combat that, I must say medical fraternity, both allopathic and Ayush systems, including Unani medicine, came together and worked in unison. And many guidelines were issued by Ministry of Ayush and other ministries. Awareness was created. Doctors like you work throughout, and we salute such warriors. And thank you for enlightening us. It's equally important that we take care of mental health along with physical health and social well-being, which are we all know interlinked to each other to maintain overall health. And very rightly said, we cannot eliminate all the pain, but we need to have a coping mechanism in place. Thank you very much, sir. Before I move to another speaker, let me check if we have some query from our participants. I can see certain comments appreciating the presentation, and then there's one comment that mental health is depend on the behavior of people inside as well as outside. The condition, prevailing condition, yes, that you highlighted in your presentation. So from my side, before concluding your talk, Dr. Dinesh sir, if I can ask, I am asking this usually to all experts in the wake of upcoming Omicron challenge. That is also now coming up, and then again that scenario is repeating. So what would you convey to our listeners from this platform? Because this is a continuing process, and now again that videos and all has been started circulating in WhatsApp, Facebook. You do not know whether it is coming from reliable sources or not. What would you like to convey to our audience from this platform?
Definitely, Dr. Ghazala, you rightly said that that same thing is going to happen again. But we are now more well informed, and now the world knows that we can tackle things in much better way, in an integrated way, and we have done it. Now you know that our number did not increase that much as were the international speculations, right? And we say control things very well with the scarcity of the resources. It is a well-known fact, and we know it now. Even as a healthcare professional or the mental health professional, I can say it. So now we are vaccinated also. But my request as a mental health care professional and a healthcare professional to everyone is that do not lower your guards still. So this danger have not yet gone, and now we are habitual of wearing mask. Now all these things. So I am again requesting all, do not lower your guards. Again, take precautions, right? And the very small childrens and these things are still unhumanized, right? And we should take our appropriate COVID precautions which were there. And we have when we pass through that big crisis, we'll go through that crisis also. And I hope that with the say progress and with the contribution of everyone and healthcare workers and the society at large, we will be able to sail through, and we will be successfully go through that period also. I hope
Sure
I've
about
been able.
Yes, sir. So we are sure about, sir, we should not lower our guard and we should follow COVID appropriate behavior. Thank you so much for joining us and enlightening us. Now, time to hear the Unani perspective, and I'll invite and introduce Professor Muhammad Idris, sir. Sir is presently working as professor and HOD, postgraduate department of Ilmul Sadla, Unani Pharmaceuticals, and HOD of Ilmul Adviya, Unani Pharmacology, and he is also currently working as head of department of Unani Medicine, University of Delhi, and he's also the principal assessor Ayush, National Accreditation Board of Hospitals and Healthcare, Quality Council of India, and he was former principal and medical superintendent Ayurveda and Unani Tippi College Hospital, Government of Delhi, Ajmal Khan Road, Karol Bagh, and he's holding membership of many important committees like member of Academic Council, University of Delhi, PCIMNH, and many others in various committees in Ministry of Ayush, Government of India, and he has been conferred many awards. So one of them is State Award for Best Serving Doctor by Government of Delhi, and Sir has published many research papers in national and international journals. With that, I invite you, Sir, to give Unani perspective on today's topic.
Thank you, Dr. Ghazala. At the very outset, I would say the initiative taken by the CCRU, Ministry of Ayush, is very laudable. Professor Asim Ali Khan Sahib, Director General CCRUM, and Advisor Unani, Ministry of Ayush, Dr. Kataria, Dr. Dinesh Kataria ji, Head Department of Psychiatry, Lady Harding Medical College, New Delhi. Officers of CCRUM, team webinar, and attending the participants. My today's talk is based on two parts. One part relates to the Unani perspective of COVID-19 pandemic, and the second part is related to the experience and lesson learned during this period. The pandemic is not new to the Unani. As we go through the system of Unani, we would have a lot of literature regarding the various types of pandemic which were documented in the history of medicine, be it the name of a plague or Black Death, or a century ago the Spanish flu or influenza pandemic, right now the COVID-19 pandemic. In these days, we are very much taking part in every aspect of this pandemic, be it the preventive aspect or management of COVID-19 pandemic in the form of treatment. In Unani system of medicine, the mental health has a pivotal role. It is mentioned under the heading of Kuwai Nafsaniya, which is one of the part of the Amure Tibia, the basic fundamentals of Unani medicine. So the Kuwai Nafsaniya deals with the mental health. If there is any disharmony or any sue mizaj, then we have a lot of indications, a lot of diseases or disorders, which we call the mental disorders. Unani classical literature has mentioned a number of diseases which relates to the mental disorders or mental health. For example, mania, melancholia, kutrub, khafkan, waswas, etc. And even the ishq. All these situations are well attended by the Unani physicians, right from the Bukrat, Jalinus, Majusi, Rabbantabri, Ibn Sina. Ibn Sina has mentioned in his encyclopedic work Al-Qanun fi Tib in the part third He has mentioned in that part a number of mental diseases, disorders, and their etiology and their management through Unani Tadabir, Unani Adviya, Adviya Mufrada, Adviya Murakkaba. He even invented a particular dosage form for mental health, Mufarrehat, which was firstly described in that part of Qanun. Besides, there are so many tadabir or procedures for mental disorders. For example, first, Natul Ras and some Nafsiyati tadabir. So Unani has a lot of things to offer for COVID-19 pandemic. CCRUM has conducted a research project as an add-on therapy in which some Unani medicines have been used for patients of mild and moderate COVID-19 positive. One part of the research was done at our hospital. The outcome of the research was very encouraging, very significant in terms of bringing down the period of disease from the prescribed period of 2 weeks, that is the 14 days, to the 10 days. Even in some patients, it was 5 days. So this was very significant outcome. And if we go through the literature, we find a number of Unani single drugs were undergone through some pharmacological, rather neuropharmacological studies and got very successful results. In case of melancholia or anxiety or depression. Similarly, a number of Unani compound formulations were also tested during the experimental study on animals or in clinical trials. Their outcomes were very successful. These studies provide us a positive outlook to integrate mental disorders or disease in current scenario. Since we are passing through a very difficult time for the last 2 years now, and it has become a new normal, and nobody knows how it will end. This is going on, and the new variant is before us by the name of Omicron, and it is taking havoc in nowadays in Europe and America, and nobody knows what's its role in India in future. So as Professor Dinesh Kataria ji mentioned all the dynamics of the pandemics and its different aspects, along with many strategies to handle. Unani is also a part in whole gamuts of mental health, because we have very good platform for providing successful treatment. Unfortunately, the conventional system has no such type of treatment or management. So I would request our Ayush fellow, especially Unani practitioners, to use these medications in the form of mufrid, murakkab, or tadvirs, so that the people suffering from mental disorders or disease be tackled properly. We have very frightening data before us. As National Crime Records Bureau, NCRB, recorded a very bad picture during this pandemic period. The rate of suicides was very high among the very young people, right from the 15 years, so young age, up to the 40 years period. Many women and even the businessmen, a number of businessmen, their percentage is as much as high as 29%. They committed suicide because the side effect of this pandemic, as mentioned by Kataria ji. And a study by the Indian scholars published in the Lancet, which mentioned as many as 37% of Indian population are suffering from one or other form of mental problems. So the situation is very grim and the solution is very limited, because as the psychologist or psychiatrist we required in India for the Indian population is very meager, very, say, the in terms of numbers, right now we have very few psychiatrists, qualified psychiatrists, hardly 900, much below the 1000, whereas we require more than 20 or 30,000 qualified psychiatrists to deal with such situation. Likewise, the numbers of the paramedics, psychiatric nurse, and other paramedics, social workers, we have very few numbers for such a big population, 1.3 or 4 billion people. So in this situation, I must say the Unani people should come forward and take this front line to deal with this situation. They know each and everything. I don't want to repeat all these things because the attending participants are mostly practitioners, faculty members, and students. They have already gone through the Unani perspective in their books, in their lectures, and in their practice also. So I request them to sharpen their soft skill. As we know, the patient in Indian perspective feel free to talk a Unani physician rather than a allopathic doctor. This is a cultural aspect of our healthcare practice in India. During this pandemic period, we have also so many stories where our Ayush practitioners, especially Unani practitioners, have been more successful to provide the help to COVID-19 positive patients. So they should upgrade their soft skill just like a counselor. And if any patient comes to his or her clinic having some mental problems, she or he does not know what the problem. So you can handle him or her with techniques, and if he or she requires some intervention, please go ahead as per the Unani mode of treatment. If the disease is very chronic, say in, for example, the depression, then you can give the Munzis or Musil therapy and some Ilaj with Tadvir's procedure, and some other medicines. I would say the patient will come out of this mental problems. In our cultural milieu, cultural environments in India, we don't consider health problem or mental problem as a health problem. No patient wants to go any psychiatrist or psychologist. So in that case, you can play a role of not only a Unani physician, but as a Unani psychiatrist or psychologist or counselor, and get rid of this, the mental problem. This is my humble request to you. Don't shy away. Take this challenge. As we have already taken the challenge of treating COVID-19 positive patient, and their side effects, we call it the long COVID. There are as many as 200 symptoms have been recorded so far, out of which more than 60 are very common. Among them, mental disease or disorders, as mentioned by the Kataria ji, right from the sleep problems, mental fog, dementia, anxiety, depression. These are some symptoms, a part of the long COVID. So please treat all these symptoms with Unani intervention. And my second part is my personal experience and the lesson learned. In our hospital, we have an experience of dealing with the COVID-19 positive patients. Last year, up from the April 2020 to January 2021, we have managed as many as more than 1,000 patients at our COVID healthcare facility in Ayurvedic and Unani College Hospital. And we come across different types of people. Every patient, we have a very long spectrum of the patients, from a 2.5 years kid to the 80 years of patient, male or female. Every patient of COVID-19 positive had a different story to tell. So our team, our doctors, our paramedics dealt with them very successfully. Earlier, it was the protocol of having 14 days in IPD in our center. So we have devised a schedule, daily schedule, which begins with the 7 o'clock in the morning with half an hour's yoga exercise, where a trained yoga instructor came and gave some asanas and some inputs regarding the yoga. And after this session of 30 minutes, then started the breakfast. And we have, in between the meals, our own formulation, the immunity booster formulation, Kada, we very popular nowadays, the Ayush Kada. So we prepared and served to all patients, and provided them some lectures by our faculty, which were on their duties. Our more thrust was on their mental status rather than physical, because there is no specific treatment to treat them with. So we focused on mental wellness by giving them some yoga or some other lectures. In between, we are providing them some nutrition also. Say gold milk with haldi wala milk. The result was very marvelous. Their outcome of the management of each and every patient was very significant. During that period, we have many instances, so the time is very less to share all these stories. One of the stories is very interesting. One lady was admitted to our CSC, and the next day she complained regarding uh, to leave the facility or call her daughter. Her daughter was admitted at far away from Delhi at Jhajjar in Haryana, AIMS CSC there. She was so furious. She broke down a glass from the washroom and threatened to our staff, if you don't leave me, then I'll commit suicide by this piece of glass. I was called and I talked to her very politely. And look, we are arranging transportation to send you, Jhajjar, to see your daughter there. She said the timeline within half an hour, otherwise I would commit suicide. Then our staff was very active and they have arranged an ambulance and sent to her to LNJP, our link hospital there, and narrated all this problem. She is in a very depressive mood. Another story relates to a very old lady of 80 years old. After her admission to our facility, she demanded bidi, smoking. She was a bidi smoker and she refused to take food. That was very big problem before us, our staffs. So one of our colleague, I deputed her, then she tackled her in a very good manner. She told her, Mataji, हनुमान चालीसा आपको याद है? नहीं बेटी, मुझे तो याद नहीं है. Then our colleague recited the हनुमान चालीसा और कहा उससे कि भाई जब जब आपको तलब लगे बीड़ी की, देन माताजी आप ये पढ़ती रहना. और धीरे धीरे उसको राजी किया कि वो अपनी जो हंगर स्ट्राइक है उसको खत्म करके अपना खाना शुरू कर दे. फिर धीरे धीरे इसी तरह से उसको काउंसलिंग की. तो इसी तरह से एक ड्रग एडिक्ट हमारे डॉक्टर ने रिपोर्ट किया कि he ran away from our facility. Then we called the police and police brought back to our facility. He was a drug addict. So we have a lot of stories to tell, but we very politely, very humbly deal with all the patients. We know they are passing through a very difficult time, very depressive time. It would have been us in their place. So similar situation we would have been faced. So very difficult was the period of quarantine, a loneliness, Another story, when some gentleman called me at very odd hours in the night from a locality of Lajpat Nagar. He told me, we are 3 in family, me, my wife, and 11 years old my son. We are all separately living in a different rooms. Can you give us some suggestions? We are all positive. So then I convinced them कि प्लीज आप अलग अलग क्यों हैं, आप एक साथ आइए ना, एक साथ रहिए. मैंने उनको एग्जांपल अपने यहाँ का दिया कि मेरे वार्ड में तो 50-50 लोग एक एक साथ हैं. आपको किसने बताया ये कि आप एक घर में 3 लोग अलग अलग कमरों में कैद हो जाएं? फिर उनकी एक एक करके बात रोजाना मैं उनका फोन आता था, जैसे डॉक्टर कटारिया जी ने कहा टेली साइकेट्री या टेली मेडिसिन से, दो आई एम नॉट क्वालिफाइड साइकेट्रिस्ट. धीरे धीरे करके उनको कन्विंस किया और उनको समझाया कि भाई आप जैसे मेरे यहाँ बहुत 1000 मरीज मेरे यहाँ रह चुके हैं, आप बिल्कुल घबराइए मत. नाउ दे आर hale and hearty, they are very much happy. So the Unani fraternity should also include ourselves from this whole problem of COVID-19 pandemics. We are not alone. We are as wanted as other peoples. We should take Unani. This is the challenge, and we should take it as an opportunity for us, for our systems, and should come in the mainstream and provide best of the best of Unani at this juncture, so that our system will be recognized, appreciated by one and all. Though our research council, Central Council for Research in Unani Medicine, is doing a very significant role. Leaders leading Unani system of medicine in all situations, including COVID-19 pandemic also. So आपदा में अवसर वाली बात को हमें इसको लेना चाहिए as a health worker, as a health practitioner. We should define our role, and we should not restrict our practice as a healthcare practitioner, but we should also prepare ourselves as a counselor to handle the mental problems. By the Unani procedures, Unani medications, and you should, as mentioned by the Dr. Kataria ji, we should also take some nafsiyati tadabir to engage the patient in his or her hobby. So by the end of my talk, I will say in the words of Ghalib, पहले आती थी हाले दिल पे हंसी, अब किसी बात पर नहीं आती. मौत का एक दिन मुअय्यन है, मौत क्यों रात भर नहीं आती. तो हमें यही मैसेज को आगे तक पहुंचाना है कि इस पेंडेमिक में हम आपके साथ हैं, हम आपके साथ बराबर खड़े हुए हैं, और आपको किसी भी तरह से फिक्र करने की जरूरत नहीं है। सरकार तो पूरी तवज्जो दे ही रही है और हमें अपने जो गार्ड्स हैं, जो कोविड अप्रोप्रिएट बिहेवियर है, उसको नहीं छोड़ना है, जैसे अभी कटारिया जी ने कहा। दूसरा, वैक्सीनेट, वैक्सीनेट एंड वैक्सीनेट, बस यही एक उम्मीद की किरण है। इस किरण को नहीं छोड़ना हमें। खुद भी, सबसे पहले हमें खुद वैक्सीनेट अपने को कराना है एज ए हेल्थ वर्कर, फिर अपनी फैमिली को, फिर जो पेशेंट आ रहे हैं उनको भी ज्यादा से ज्यादा कोशिश करनी है कि हम पहली डोज, दूसरी डोज लें, जिससे अपनी भी हिफाजत करें और मरीज की भी हिफाजत करें। ये बहुत जरूरी हो गया है। और हर मिस इन्फॉर्मेशन का, जो कोरोना फोबिया को बढ़ा रही है, या वैक्सीनेशन को भी कुछ लोग अदर वे में ले रहे हैं, उसको भी काउंटर करना है आपने। तो दोनों फ्रंट पे आपने काम करना है। एक तो जो प्रिवेंटिव एस्पेक्ट है उसको करना है, और वो यूनानी के अंदर असबाब सत्ते जरूरिया से अच्छा इतने जो 6 कमांडमेंट है, वो फैक्टर नहीं कहता मैं उनको, आई वुड से द 6 कमांडमेंट, उन 6 कमांडमेंट को अगर हम फॉलो करें और मरीजों से कराएं, आम पब्लिक से कराएं, तो मैं समझता हूं कि हमारी रेजिस्टेंस, जिसको हम इम्यूनिटी बार बार बोल रहे हैं, हमें रेजिस्टेंस भी बोलना चाहिए, हमारी बॉडी की इतनी ज्यादा रेजिस्टेंस बढ़ेगी कि फिर वो कोरोना वायरस जो है वो फिर शायद कुछ ना कर सके, चाहे वो उसका बदला हुआ स्वरूप ओमिक्रॉन की शक्ल में हो या फिर और भी कोई दूसरी शक्ल में हो। तो मेरी हम्बल रिक्वेस्ट है जितने भी अटेंडीज हैं उनसे, कि आप, ये मौका है यूनानी को आगे लाने का, लोगों तक पहुंचाने का। आप एक बार उसको, यूनानी की जो दवाएं हैं जो आपने अभी तक किताबों से पढ़ी थी, आप उनको एक बार इस्तेमाल करके तो देखिए, फिर आप खुद, आपके अंदर कॉन्फिडेंस होगा और तब आपको पता लगेगा कि ये कितनी एविडेंस बेस्ड है। आज के जमाने में हम हर चीज को एविडेंस से जोड़ रहे हैं। हम दावे के साथ कह सकते हैं कि यूनानी के लिए ये पेंडेमिक नई नहीं है। जैसे अपनी मैंने बात से शुरू की, यूनानी के लिए ऐसी बहुत सारी पेंडेमिक्स हम देख चुके हैं और सभी में हमने यूनानी को अप्लाई करके दिया है, यूनानी का इंटरवेंशन किया है, चाहे वो ताउन या ब्लैक डेथ के नाम से हो, या आज से 100 साल पहले जो स्पेनिश फ्लू हुआ था, 1916 से लेकर 1921 तक रहा था, उसमें भी यूनानी का ट्रीटमेंट बहुत जबरदस्त रहा। और मैं एक वाकया बता के अपनी बात को खत्म करूंगा। हाजिक जो किताब खानदान शरीफी के हुक्मा ने लिखी है, उसमें आप देख लीजिएगा, उसके अंदर इसका जिक्र दे रखा है फ्लू का, और जो जो वबा है उसके बारे में, और एक फुटनोट डाल रखा है उसके अंदर ये, कि उस वक्त दिल्ली के जो एलोपैथिक डॉक्टर्स, वो रात में हकीम साहब के मतम में आते थे और उनसे मशवरा करते थे, हकीम अजमल खान अलैहि रहमा से, कि आप हकीम साहब बताइए कि यूनानी में इस इन्फ्लुएंजा जो जो वबा चल रही है, जो पेंडेमिक चल रही है दिल्ली के अंदर या दिल्ली से बाहर और पूरी दुनिया में, आपका यूनानी में क्या इलाज है। आपने वो नजला हार के उसूल के मुताबिक आपने जो इलाज बताया, आज वही कारगर है, वही दवाएं कारगर हैं। और अभी काउंसिल ने जो अपना रिसर्च प्रोजेक्ट अभी किया है कोविड-19 में, उनके मरीजों के ऊपर, और उनका बहुत ज्यादा उसका रिजल्ट और आउटकम आया है। तो ये हमारे सामने एक एविडेंस है। हमें पूरे जोश के साथ हमें इस पेंडेमिक का मुकाबला करना है, आज भी करना है, कल भी करना है, क्योंकि पता नहीं कि कब इसका इख्तिताम हो, कब इसका अंत हो। और हमें एक न्यू नॉर्मल एनवायरमेंट और इस फिजा के साथ रहना है, बगैर किसी, पहले अपने मेंटल हेल्थ को सुधारते हुए, फिर अपने फैमिली, फिर अपने नेबरहुड, फिर उस अपने मरीजों के साथ। बहुत बहुत शुक्रिया, धन्यवाद।
Thank you, sir. Thank you. So kindly mute yourself. I can hear an echo. Hello. Yeah, now it's okay. So just to add, sir, what you were suggesting, CCRUM under the visionary leadership of our respected Secretary Sir and our Director General, Professor Asim Ali Khan Sir, is engaged in many multifaceted activities, and our officers have worked hard along with our other fellow colleagues in other organizations, and we have created awareness, and Ministry has also brought out guidelines for Unani professionals and issued advisories in each Ayush system, including Unani system, to create awareness. And yes, we are, we have conducted many also. So thank you for that insight and letting us know the Unani perspective and efforts made by Unani professionals along with other Ayush professionals at central as well as state level. And indeed, addressing mental health along with physical health is of utmost importance. And in fact, all the medical system lay importance on this aspect. Unani medicine also have highlighted diagnosis, treatment, and management of various mental health problems. So, indeed, sound minds helps us in making correct decisions and helps in coping all difficult situations. And you also gave us a takeaway message. Before inviting the moderator of this session, I saw some questions which are addressed to Professor Dinesh sir. So I'll request him to kindly address this. This is from Mr. Tosif Rafiki. He's saying, sir, does pandemic shows any positive impact with relation to mental health?
Uh, Thank you. I hope I'm audible.
Yes, yes.
Say we earlier thought that the enjoyment is there outside, and we were eating up from outside, right? And say for all things we were enjoying outside. And when we were homebound, so we knew that, and we were surprised those things were outside available, be better than those they are available at home, right? So this pandemic have shown this way, right? And this pandemic, let us, this telemedicine guidelines were not from their Medical Council of India or NMC. The moment the pandemic came, that liberty came to us, and most of the things can be tackled through telemedicine also, which we frequently
Yes.
used, and this all media which were using earlier, these were not being used as that. Now the even conferences are in the hybrid mode. Earlier they were on the this thing, right? And our prescriptions, they are being honored. The telemedicine prescriptions are honored in all the pathies, Ayush and all that, right? And then we thought of beyond that. Earlier, to share you one thing, that I was thinking that how we can popularize the mental health. So then I thought, when there are so many things through distance education and all that, so I approached Indira Gandhi National Open University. And I'm a very big fan of this Ayush, because so many things. I was living outside this Afzal Khan Road, this in front of
College.
Tibia College. When I had some personal problems and my pathies were not working well, so, and we have got summer holidays for 34 days. So I visited Tibia College many times, and so many chronic things were, they got settled. I remember that one time this. I had dry eyes and I tried everywhere. So then this Tripan was done, and now I don't have any problems. Similarly, I had irritable bowel syndrome type of things. So now I do not have that problem. So I'm really thankful to them. Then at that time, I thought that when there are so many colleagues in which there is no MD and all that, no specialization. So I talked with the IGNU people. So we designed PG diploma in mental health. It is for all pathies. This for MBBS, for Ayush, means all pathies of Ayurveda, Unani, Yoga, Siddha, and nursing and all that. And Lady Harding is a center for that. And last time there were 550 students enrolled to this. Those who were not able to access to the medical college and this thing, we have got only 240 hours of the contact program, and this diploma is awarded. And it is very easy for the doctors to do. So I did for that. And there were any most of other things also that we thought that we cannot deal with the other things also, So even the psychiatry residents in the other residents, physiology residents, they were put on for the emergency duty. If corona would have not come, we thought we will not be able to do venipuncture again. We will not be able to do this and that thing. And they shown us a respect toward other pathies also, because as Professor Muhammad Idris have mentioned, that so many things are, they are complementary to each other. In fact, say I will request through this sort of galaxy of the people that we may think of PG diploma in integrated medicine. So many good things are there in your pathy, in our system or in other system. So when if we come on the single platform, because in all the hospitals now, in my hospital, Lady Harding Medical College, there are Ayush people available, there are chambers of those people, and we are already working together, so we can come out and help each other with coming this thing. Definitely this question is very good, that why what we have learned from this thing. The good thing is that we have started living together. We were roaming outside here and there, we were eating outside, we were not respecting other people, and we were not knowing our family members well. We were finding happiness outside, and we got it from family as well, right? And we are respecting more, and we have started respecting other people also, and so many behaviors we have changed. So it is a big gift from corona, and we are wiser than before also.
Yes. Yes, very
Any
rightly
other
said.
question?
Yeah. So you very rightly said, and that's what Professor Idris also highlighted, that we need to work together. And now Ayush systems under the Ministry of Ayush has made a mark for itself, and it's available and at each and every platform. And we are working together with our counterparts in both ways, collaborating with allopathic counterparts as well as intra-Ayush collaboration. So whatever the strength areas in each other system, we are carrying that forward also. There's one more question for you, sir. Which set of population was affected more during the pandemic? Which set of population? Or maybe he wants to say age group.
Say it was in different population, different phases, because when we were not vaccinated, so all were vulnerable. But
Especially, I think
those who were not,
he's asking for mental health. Which set of population was more affected when we are talking about mental health perspective?
so there was a say sort of, most of the people in most of the area of the mental health, they were affected. I tell you the truth, because people were afraid for coming to the hospital. Those who were settled well, they did not come. Everyone is not aware of all these telemedicine facilities or mobile and all that, and say, some of the people, they left their medications, relapses were there, right? Those who were less sort of prone, I showed in one of my slide, those who were less prone, they became prone. Those who were normal, they started having so many thoughts about this thing, they were worried and all that, or they were worried about their parents. So distance population were there, so no one was spared. The answer is that no one was spared. Say the we were not expecting that. OCD increased. People started washing their hands time and again. They were not having sort of this thing, no, that even normally also, when you were not busy, so let us wash our hands, right? So they started having frequent inquiries. डॉक्टर साहब कोई गड़बड़ तो नहीं है, हम बार बार हाथ धोने लग गए हैं, right? So they become so much this thing prone to the cleanliness, and they were so many, and they become almost suspicious also, and the corona will not contract us and all that. So the answer is that every population were affected a lot. Those who were not able to reach us, they were affected a lot, right? But somehow, I tell you, our population, those who were coming to us, because the COVID affected were that so many of the hospitals, they were converted into COVID hospitals, and the general OPDs and the specialties were closed. So in that time, because this LNJPL Monarch were COVID hospital, so many the psychiatric services, we did not close our psychiatric services. And in central government hospitals, see, lot of medicines are there, and they did not go back. So our OPD attendance have increased almost double time. So earlier they were affected, now they have got some solutions also. And most of the populations were affected. Even those who were maintained well, they were affected. Those who were not having problems, they started having problems. Those who were in between, those who were settled, they became prone to relapse. So these things were there. And elderly and children were most affected if out of these population we count.
Thank you. Thank you, sir. So now I see Jafri, sir. So I invite the moderator of the session, Professor M.A. Jafri, sir, from Department of Ilmul School of Unani Medical Education Research, Jamia Hamdard, for his concluding remarks. Sir, kindly unmute yourself. Sir, we cannot hear you. Kindly unmute yourself. Niranjan ji, can you help us? Jafri sir, maybe you can use camera in your desktop and you can use your mobile for talking.
Yes.
Yeah.
Now
Now
you're
we can.
audible.
I think now I'm.
Yes, sir. Please continue.
I should be audible now.
Yes,
Now
sir.
you're
Hello,
audible.
am I audible?
Yes.
Yes.
Now? Okay. Yes. Honorable DG CCRM and other panelists, Dr. Dinesh Kataria and Professor Idris sir, and the very dynamic team of CCRM, including Dr. Ghazala, Dr. Farah, and other doctors. First of all, I would like to thank the organizers for giving me this opportunity to be included as the moderator of this program. Truly speaking, I was more comfortable as a listener because today I gained many things, several things from Dr. Dinesh Kataria and both Dr. Idris as well, who have elaborated their views on this very topic of keen interest, and the which perhaps all of us are very much concerned with this problem, psychiatric problems. Perhaps a lot of people have suffered in COVID-19 due to COVID-19 with from psychiatric problems like anxiety, depression, etc. Dr. Dinesh has very well elaborated the whole scenario during the pending situation and about their role of various hospitals. He very rightly said, I would like to congratulate the psychiatrists of India that they did not close their OPDs, but they worked hard simultaneously with other doctors. As you know that most of other OPDs were closed uh, for combating the various disorders of COVID-19. But as it was a very important problem which was faced by almost all of us, and especially I'm seeing the problems in among the students who are not able to join their classes, their colleagues, so they are suffering very much. And now I have seen many of these students going to psychiatrists for finding some solutions of their problems. As far as Dr. Idris is concerned, he has elaborated very rightly, very in very much detail about the solutions what Unani can provide. As we are seeing that CCRUM is already playing a very significant role in this area, and besides CCRUM and other councils of Ayush, they have given very much important guidelines in this scenario. And Dr. Idris has very rightly said that we, the Unani people, should come forward and should not lag behind, and we should work in the mainstream, and as it should be taken as the opportunity for showing our strengths, and this is the right time. And most of us have done a good job also in this regard, but uh, all of us perhaps should come forward and take these advices which have been given very rightly, and these are very timely advices. We should work hard and we should prove ourselves. And because we have a very good literature, a very vast literature as far as Unani system of medicine is concerned, and I will talk also other systems of also, they are very rich, especially Ayurveda is very rich in combating these disorders. And Dr. Idris has pointed out about the role of 6 essential principles, nafsiyati tadabi, which has been covered very well in Unani medicine. If we go through our strengths and we find some solutions, it is very right that rightly can be said nothing has been done. But because it is said that almost at every century we face these types of pandemics or endemics, but sometimes every yearly also, and we have given very good solutions. If we go to our literature, we can provide very good results. So in the end, I would like to thank the organizers for organizing such a nice webinar on this topic. Thank you very much.
Thank you, sir. Thank you for wrapping up the session with your concluding remarks. And now to propose vote of thanks, I invite my colleague, Dr. Pradeep Kumar ji, who is a senior research officer pathology and is involved in important work related to EMR projects, drug procurements, ethics committee, along with other important portfolios. He is a hardworking and a dedicated officer of the council. Dr. Pradeep, please.
Thank you, Dr. Ghazala, for providing me an opportunity to propose the vote of thanks in today's webinar on taking care of mental health during and after COVID-19. I'm thankful to Professor Asim Ali Khan, DG CCRM, and Advisor Unani, Ministry of Ayush, Government of India, for delivering his welcome address and his guidance in organizing the webinar series. I also extend my thanks to the esteemed speakers, Professor Dinesh Kataria, Professor and Head, Department of Psychiatry, Lady Hardinge Medical College, New Delhi; Professor Mohammad Idris, Head, Department of Unani Medicine, Ayurvedic and Unani Tibia College, New Delhi. I am also grateful to the moderator, Professor M.A. Jaffrey, Department of Ilmul Adviya, School of Unani Medical Education and Research, Jamia Ahmedabad, New Delhi. I would also like to thank the organizing team, especially Dr. Ghazala Javed, Research Officer Unani, Scientist 4, and a team for coordinating the program, along with the IT team, social media team, and all other associated staff. Thank you all.
Thank you, Dr. Pradeep. And now, before concluding the session, I would like to request all the participants to join us tomorrow. Tomorrow we have concluding webinar, 5th one in the series, and it is on the post-COVID complications and care. At the same time, 2:30 to 4:30 p.m. We'll be here, and please join us. And do not forget to fill the feedback form, which once you close this window, another window will open up, and you can give your feedback and suggestions, which are important to us. So I once again thank our DG sir and esteemed speakers, moderator, and Dr. Pradeep. Thank you very much. Thanks once and all.
Thank you.
Thank you.
Thank you so much.